failing, poor performance, not fit for purpose. These are the damning findings from a review into the health and social care watchdog, the Care Quality Commission.
Well, it's found multiple weaknesses in the Commission's ability to regulate our health services. And the Health Secretary, Wes Streeting, joins us now. A very good morning to you. How aware were you, whilst you were Shadow Health Secretary, of how bad the Care Quality Commission's ability to actually rate our places of care was?
So I'd heard complaints about the Care Quality Commission, and in stark contrast to my experience as Shadow Schools Minister, where I don't think I ever went in to talk to education staff and found them saying we need more Ofsted, we need more inspection. That never happened. Yeah. In health and social care, what I found were staff, particularly nurses, saying we don't think they're thorough enough, they're not asking the right questions, and they're not talking to us, the nurses, about what we're seeing in patient safety. So I knew that there were shortcomings that I would want to address if we won the election. What I did not expect was that in my first week as Health and Social Care Secretary, I would be confronted with a report that said that 1 in 5 health and care providers had not received the rating, that the ratings that had been published we could not have confidence in as accurate and reliable and true and fair accounts, that we would have hospitals that hadn't been inspected for a decade, care providers not inspected since 2015, people going into care homes with no experience of common conditions like dementia and making judgments about the quality of care, people going into hospitals with no experience of actually providing care in hospital. Any one of those things would be shocking in themselves. Taken together, they are a damning indictment on a regulator that is supposed to safeguard care standards and patient safety.
Yeah, Wes Streeting, I have to say, there'll be lots of people out there thinking this is refreshingly honest from a politician, right? You've said that you are stunned by what you've discovered. Just sort of helping us understand what this means. The CQC rated Shrewsbury and Telford NHS Trust as good in 2015. At or around that time, 201 babies died of what's described as avoidable deaths. Given what you now know and how stunned you are, right, and the report is not going to come out until the autumn, how worried should people be? How safe are our hospitals?
So I'd say a few things. Firstly, if you're looking on the CQC website today and looking at those ratings, take them with a pinch of salt. One of the reasons why I've chosen to publish an interim report today is to be honest with people as quickly as possible. And I've asked the CQC to urgently qualify those ratings with the background information about how those ratings were reached. In terms of how safe should people feel today, well, speaking for myself, I feel safe at my local GP. I feel safe at my local hospital today. But overnight, I got a tweet from a guy waiting in appalling conditions in A&E at a big London hospital, who I doubt felt he was in a particularly safe environment. People on trolleys today may not feel safe. People who are in intolerable waits may not feel safe. And I think the reassurance I can give you, having been in this job for 3 weeks now, is I'm never going to brush these problems under the carpet. I'm never going to pretend things are going well when they're not. Right. And in that honesty is contained, I think, the hope and the chance to turn this situation around. Because what does give me confidence is that there are brilliant people in the NHS and social care who are doing brilliant, great and safe care day in, day out, but they're working in intolerable conditions.
On a quick answer, is it time to hold people to account? For example, the current interim chief executive, Kate Taroney, was appointed last month, but she joined the CQC in 2019 as chief inspector of adult social care and integrated care. Now, we've just heard instances of people who are singularly unqualified to be evaluating those places. Are you going to be a Secretary of State that looks at leadership of organisations like this, especially the CQC, and said, right, it's time, people are responsible, heads should roll?
Yes, but I'm not going to do trial by the court of public opinion. We've got to make sure we get this right. And one of the things that Dr. Penny Dash, who's done this report for us, has said is that within the CQC today are some brilliant people, expert people, who have been actually instrumental in sounding the alarm and giving Penny Dash the evidence that she needed to draw such robust conclusions. So I don't want to tar everyone with the same brush. And what I will never do as the Health and Social Care Secretary is to scapegoat people to look tough. Where people fall short of the standards expected, they will be moved on. We will not tolerate failure. But what I won't do is pull the trigger on people shooting from the hip to look tough, because that's not the responsible approach we need. And the culture I'm trying to build in the NHS is a culture where people can come forward, can raise the alarm, can be honest with me about the challenges, and know that if they're honest with me, I'll be honest with them, and I'll support them to do the job that needs to be done.
And Wes Streeting, how honest are you being with the junior doctors? Because, simultaneously, on the front of the Daily Telegraph, Chancellor to reveal a £19 billion hole in finances. At the same time, of course, you're in talks with the junior doctors. Now, you clearly want to avoid another strike under Labour. Would you see that as a failure if the junior doctors went out on strike again? And what is it that you're promising them? Are you being honest with them about what kind of pay rise that they can expect?
Strikes are always a sign of failure and bad industrial relations, and I've rang the junior doctors on day one, got them in week one, and we are now well into negotiations. I want to rebuild the trust and the respect that was lost between junior doctors and their government, and actually I think that's true right across NHS professions, actually.
Just to interject there, I mean, I know you've spoken and said that you don't want the NHS and your department to be like a begging bowl to the Treasury, and that's a sort of interesting phrase you use there. But ultimately this is going to be about giving the doctors something more than they were being offered under the Conservatives, and that is money. So where's it going to come from?
That's right. Money is part of it. Now, one of the promises I made to junior doctors on day one and in the weeks that have passed since is that I'm not going to provide a running commentary on the negotiations, and I'm going to keep that promise. We are working together because we want to solve this dispute.
But do you think that those patients who have had their appointments put back further and further and further, sometimes because of the junior doctors' strikes, but because of the general problems with the NHS, don't they deserve a running commentary in a way about how it's going, about how soon they might see their junior doctors not going out on strike, and where's the money coming from? These are questions that the public want answering.
Those are fair questions, and so what I would say to your viewers is judge me by the results, and I will answer all of those questions when we get a result. Until then, the worst thing I could do in terms of trust with junior doctors is break a promise that I've made, that we won't provide a running commentary, and that we will carve out the space that we need to bridge what has been so far an intractable divide between junior doctors and the previous government. I'm working to rebuild trust with NHS professions right across the board, and I said at the start of this process I was optimistic a deal could be done. Nothing that's happened in the last 3 weeks has shaken that optimism, and I promise when we have a deal, I will come forward, explain it, and answer questions on it in a full, open and transparent way.
While we've got you here, Wes Streeting, how optimistic are you about provision of social care, which is also in crisis? Now, the Lib Dems invited in their election pitch a cross-party plan, which you signed up to, because everybody agrees across the board that social care is a disaster. Many of us have personal experiences. I suspect you do too. Are you going to sign up to that and get, frankly, what is a crisis, resolve that crisis?
Yeah, it has been striking during and since the general election, that we now had the Conservatives, the Liberal Democrats and Reform all saying that they want to work cross-party on social care. And there have been various options floated in the media and in Parliament, from a Royal Commission to cross-party talks. And I'm reflecting on the best way forward. I do want to work cross-party, and one of the things that Keir Starmer and I have both said, actually, is regardless of the size of Labour's majority, and we've got a healthy majority in the House of Commons and a strong mandate, on this issue, and actually on other issues where we've got common ground, we do want to reach across the divide. And on social care, it's not been a shortage of good ideas over the years. It's been a shortage of good politics, and I'm determined to get that right.
Wes Streeting, good to have you on the show this
Thanks,
morning.
Emily.
A lot on your plate and a lot to deal with. Thank you so much.
Thanks so much.